Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi gito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na minatapakan pala siya. So, probably, yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advisean na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo, kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, kinakapa ko siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
And we are live. Healthy day, everyone. My name is 𝘗𝘳𝘾 𝘽𝘍𝑜𝘆, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of powerful food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. Today, we'll unpack what immunotherapy is, who it's for, how it's integrated with other treatments, and how to care for the whole person, mind, body, and immune health. For our topic tonight is entitled Metastatic Breast Cancer, Effective Management Through Immunotherapy. So let's align on definitions. Metastatic means that the cancer has spread beyond the breast to other parts of the body. So commonly bones, liver, lungs, and brain. Now, treatment is typically systemic. It works throughout the body. Today's MBC care is personalized. So tumor biology matters, hormone receptor status, HER2, PD-L1, and for some, BRCA or other mutation status. These markers help your care team choose the right combination, whether endocrine therapy, targeted therapy, chemotherapy, radiation for symptoms, and for eligible patients, immunotherapy. So if you are a breast cancer patient, please comment down on what treatment you're currently undergoing. Now, what is immunotherapy? In simple terms, some cancers hide by putting masks on our immune cells. So sometimes it's combined with chemo to unmask the tumor. Now, for patients on or being evaluated for immunotherapy, number one, know your baseline labs for liver, thyroid, and adrenal, then recheck often to monitor. Now, you should also flag symptoms immediately, like new or worsening cough, shortness of breath, persistent diarrhea, yellowing of eyes or skin, severe fatigue, rash that spreads, and headaches with visual changes, because early action prevents complications. So, tell your team about all medications and supplements because some can actually affect liver enzymes or the tone of your immune system. Timing matters. Do not start anything new without clearing it with your doctor first. Lastly is the whole person support. So while treatment targets cancer biology, your daily habits support recovery capacity. For sleep, you should prioritize regular sleep, aim for 7 to 9 hours, breathing exercise, and morning light exposure for stress, because these modulate inflammation and mood. And for movement, should do gentle and regular exercise to support energy, bone health, mood, and function. Bottom line, you are not alone. Your care team, your community, and resources like this seminar are here to help. And now for more help, trust the experts. First, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore, Mr. Shyan Lim. Up next is Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine, a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life, Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening, gentlemen.
Good evening, Jen. Good evening, Dr. Jansen.
Hello, good evening. Good evening to you.
Doc, could you walk us through how you stage and profile and set goals for MBC in 2025? And when...
Okay, so staging, when for staging, it's still the regular, how conventional oncologists does it though. So for imaging, it's very important to know the extent in which the cancer has spread. No? So that would be primarily through imaging. Okay. Now the pathologic, there is also clinical staging. That's clinical staging. So for clinical staging, we use physical exam and imaging results. So for imaging, that would be CT scan, MRI, or PET-CT scan. Now for the pathologic staging, you need a biopsy for that. And the pathologist is the one that shows or indicates what the pathologic staging is. So clinical staging and pathologic staging are different, but both are important, equally important, because both determine treatment modalities or treatment of choice, no, especially when it comes to the conventional oncos. But on my part, whatever the stage is, generally the approach would be the same, no. So yeah, but nevertheless, I still ask the patient, no, to stage to do staging properly. This is so we get measurable outcomes, so we know what your baseline is, and so when we do treatment, your cancer journey, when we see improvements and or progression of cancer, we know where you came from. Yeah, we know the baseline, so staging is very important.
Dr. Jansen, I have a follow-up question for you. Doc, for staging in cancer, which is the stage where everything sort of ramps up, and that how should a patient approach their cancer treatment depending on their staging? So let me be a bit more specific. Is it is there a difference for the patient in terms of their approach towards cancer if they are stage 1, stage 2 versus stage 3, stage 4?
There shouldn't be any difference, no. The general advice is it's the same. So in terms of lifestyle, so when it comes to food intake, the patient should be primarily on a plant-based diet. Okay, there should be adequate protein intake, because the protein intake would sometimes determine whether or not a patient can develop complications, okay, later down the road. Now, so this is lifestyle, okay? So patients should still be sleeping, 7 to 8 hours every single day, every single night, exercising, avoiding biases, so all these things, no? Only time that these advice will change is when a patient's conditioning changes. So we have what we call an ECOG scoring, ECOG. This is also known as your Karnofsky scoring system. No? So this determines the quality of life a patient might have, or the condition of the patient in general. So depending on the conditioning of the patient, nutrition, physical activity can change. Okay, so this should still be tailored to the patient's condition, and not taken as a general advice for every single cancer patient. Okay, but there is a that I just mentioned. Yeah.
So, Doc, for stage 3, stage 4 cancer patients, they are metastatic already. So, will their treatments generally be more aggressive than stage 1, stage 2, or actually it's not? It doesn't necessarily be the case.
Aggressiveness of the treatment really depends upon the. It really depends upon the agreement between the doctor and the patient. And so what would be the factors that would determine that decision? Number one is quality of life of the patient. So a patient, so for stage 4 cancer, stage 4 cancer patients, there are stage 4 cancer patients, when you see them, you won't know that they are sick.
Okay, because they look normal.
Yeah.
They look and
they
talk
look
and
normal. Yeah. They work regularly like normal people. You will know that they are battling stage 4 cancers. It's when they tell you. Okay, so there are patients who are like this. So there are also patients, stage 4, wherein they're very, very weak already. They're in their so to speak, so quite weak, no? So you will understand bedridden, poor appetite, bloatedness, so all these things, no? So it will depend. So the advice would depend on this factor. So the aggressiveness of the treatment will also depend on this. Now, for a patient who is quite strong and healthy and young, relatively young, no, I should say, then you have to push a more aggressive when you can, it's not you have to, you can push for a more aggressive treatment because the life expectancy is long enough and the conditioning of the patient is very good. So in terms of handling side effect of the treatment, the patient would be able to tolerate it much better compared to a patient who is already very weak, already on bedridden and all. No, the treatment now would be more limited, so it would now be palliative. Now,
Wow.
I'm not saying that we give up treatment altogether for a patient who is quite weak. It's not the case, no. It's just because we have to balance the benefit and the risk of different cancer treatments. So there's no point giving a cancer patient who is very, very weak, almost in his or her twilight years, and the remaining
Make their
time
life
here on
difficult,
Earth
right?
would be very poor. No, quality of life would be
Yeah.
very poor. So there's no point making the person suffer. So
Yeah.
the priority changes wherein we prioritize quality of life over treating the cancer and killing the cancer cells. So yeah, so that's the difference.
Doc, as you speak, I'm reminded about our conversation with one of the leading doctors in cancer treatment. I mean, Dr. Ignatius at PGH, right? He actually shared something very encouraging with us, that it is now the move in oncology to actually be less aggressive in the treatment. I remember him actually mentioning that in the past, they will go very aggressive on like chemotherapy. Now they will instead try to go for the minimal instead of the maximum. So there is a shift in cancer approach in general. People are even doctors are trying less to exactly do what you said, Dr. Jansen, to actually ask the patient what they want and balance the type of treatment available versus what the patient will take. Doesn't mean that it's available. We will administer to the patient at the strongest level of a dosage. There is now greater consideration about what patients want. Yeah, so that's really very progressive, I guess. Yeah. I
That's
remember
why.
medical ethics, right? Patient agency. And that's something that I think we're respecting more and more by helping the patients understand that they do have agency. Yeah. Jen, you were saying something?
Yeah, that's why Miss Salia Bougainvillea commented that I am happy to hear today's program is about breast cancer. Thank you very much.
Breast cancer is a cancer that has very high success rate in terms of recovery today, especially if diagnosed in the early stages. That's why we really do try to do your best to if you catch breast cancer early in stage 1, stage 2, there are many, many options for you. And like what Dr. Jansen said, especially if you're healthy, you should really avail yourself to all the options. And here in our program, we actually believe in using as many proven, my keyword here is proven, evidence-based options that you have, rather than just stick to one or another. Yeah, all right.
Okay,
Jen?
well, let's first catch up with the previous questions we couldn't answer in the last webinar. From Mr. Jun Lanes, can we use PPARS liquid for cervical cancer stage 4 metastasized to the lungs?
Yeah, you can, no. So you can use PPARS liquid as an adjunct to chemo or radiation. But at this point, probably not radiation anymore, probably chemo. For stage 4 cervical cancer, immunotherapy is also one of the things that oncologists can recommend to a patient, provided you qualify for it. PPARS also works well with immunotherapy. Okay. So those are so definitely yes, you can use it. If a patient is quite weak already, since we're talking about cervical cancer, which has metastasized to the lungs, you want to strengthen the patient, you can use PPARS liquid. So the answer is yes.
I also want to say that PPARS liquid is quite ideal in these circumstances because it provides quality of life to many of the patients that use Simply liquid PPARS. I remember many doctors, including Dr. Jansen's patients, where they were bedridden and they were able to then sit up and walk with assistance, right, in a very short amount of time. So it really does provide that quality of life for patients, for most patients who use the SimplyNature PPAR liquid. So it works for both options for metastatic lung cancer, breast cancer that spread to the lungs.
Okay. Next question coming from Ms. Rosel. Can PPARS help with benign paroxysmal positional vertigo?
Wow.
No.
So,
No. Okay. Benign paroxysmal BPPV. BPPV. What is it? Okay,
Yeah, what
so
is
that's
it?
vertigo. What
Oh,
happened?
it's vertigo.
Yeah. Our ears have vestibules.
Yeah.
Inside the vestibule are salts, no? So when those salts gets dislodged, then that's the time that you feel vertigo. Now, benign paroxysmal positional vertigo is when there's a certain position of your head that triggers the solution. Here is repositioning of the salts. Very simple. Go to your ENT doctor, have it repositioned. Very easy.
So it's a surgical procedure, doc?
Very easy. You don't have to. It's just, manipulation of your head.
Oh, wow. Okay.
That's it. That's the treatment. Yeah. It's repositioning of the salts that got dislodged inside your ear that controls that gives you the sensation of
Vertigo.
movement. Yeah, so that's the one that's producing the vertigo. So yeah, that's the solution. Okay.
So, doc, is it even a minor surgery or is a external manipulation?
No surgery. Nobody will cut you open.
Oh.
It's manipulation of your head. That's it. It's just moving your head like
moving your head in the correct.
Yeah.
Oh, wow,
yeah,
that's
yeah.
a simple
Very easy to
solution.
do.
Okay, I think for this particular viewer, you must be so happy hearing what Dr. Jansen shared. Your solution is very straightforward and simple and no surgery involved. Someone just needs to shake your head correctly. So go and see your doctor for that. Hallelujah.
okay, before we go to the next question, let me just greet one of our new viewers, Miss Lyra Poblete. Okay, next question coming from Amy. Can PPARS help stroke patient?
Oh.
Yes. For stroke patients, so you have two kinds of stroke, hemorrhagic and ischemic. So PPARS helps both. How? For ischemic stroke, there's a blood vessel inside your brain that got obstructed. So PPARS, the role of PPARS is to help your body control metabolism, because it's usually the one that triggers that ischemic stroke is either a blood clot it's either a blood clot from elsewhere that got thrown up to your brain, or it's cholesterol buildup. So PPARS helps lower inflammation, improve blood vessel integrity. It can also help lower cholesterol as well. In general, your metabolism and inflammation. So that can help lower, it can help prevent stroke from happening. And if you are already a stroke patient who suffered stroke already, in terms of recovering, it can help lower neuroinflammation or inflammation inside your brain. So yeah, it's good to have this if you're a stroke patient. Now, if you're someone who got hemorrhagic strokes, the same thing, no? For hemorrhagic stroke, the trigger there is hypertension. It's hypertension. So with hypertension, PPARS can help improve the integrity of the blood vessels. So it's the same thing, almost the same mechanism of action. So that's how PPARS can help both patients. Now, again, if you suffered from hemorrhagic stroke already, then you're undergoing rehabilitation. Same thing, no? The role of PPARS would be to lower neuroinflammation and to help your brain heal itself, in other words, no? So that's how.
Yeah, I want to share good testimony. It is actually a personal friend of mine in Singapore. He's an Indian. He suffered from stroke. I'm not sure if it's ischemic or hemorrhagic, but his was actually not, it was not health-based, it was stress-induced, actually. And he lost sensation to half of his body. Actually, not half, three-quarters, both left. One side completely and then partially on the other side. So yeah, he was able, the doctor did not expect him to walk normally ever, actually. He actually achieved that in a year. So it was quite miraculous. He was actually very focused on his rehabilitation, and he was taking PPARS liquid at the same time. So again, it's not just PPARS alone. All right, PPARS will work even better when you're actually doing other protocols because it supports your body's efforts, right? Like in physiotherapy, because it manages the inflammation and neuroinflammation. It also gives you, it manages your other metabolic syndromes as well. That is the root cause of many strokes. And all that works together and just helps your body recover. All right, so yeah. So don't just PPARS alone. You got to also do your physio. You got to have a positive mindset. This one is the most important. For my friend, he really wanted to get well, and he really did. It was quite a miraculous case. And now he started a foundation for stroke patients. So there you go, right? Yeah.
Nice. Okay, our new viewer, Ms. Lara Poblete, has a question. Can we use PPARS on breast cancer stage 4 with metastasis, not undergoing chemo and radiation yet? And is the medication can prevent the spread of cancer which is starting?
Yeah, Doc, how do you
Okay,
minimize metastasis? How do you minimize metastasis?
It depends on the gene expression of the cancer. It depends on the expression of the cancer. So the answer to the question is yes, but not 100% yes. Okay, not 100% yes. There's a chance that it will not work. Same thing with every other supplement out there. Same thing with every other supplement out there. So how do you do this? You have to know the gene expression of the cancer to do it properly. Yeah, okay. So that's the answer. I won't go into how do you know, because you guys won't understand anyway. It's too technical. Okay.
So
Yeah.
go for a consult with Dr. Jansen. Bring your diagnostics, and then you will get a more detailed answer. Yeah. Doc, she has a follow-up question. Is there any minimally invasive treatments or therapy that you can recommend for a condition? Yeah. I think go for a consult.
Minimally invasive. Yeah, you have to go for a consult. But here's the thing, no. If the cancer has spread, the remaining treatment that would be applicable for you would be systemic therapies. So that would include chemo, targeted therapy, your immunotherapy, cancer repurposed drugs, some natural extracts, intravenous high-dose vitamin C, these things, no? The question remains, how do you prevent for sure? So the answer to that question is you have to go for we have to know the gene expression of the cancer cells. So this is like knowing the face of the cancer cells, so that you know how to address or how to turn off those genes, what natural extracts would be good, would be effective to use to get to breast cancer. Say for example, breast cancer, no? Both of you are the same. Both of you are of the same subtype, same stage, same age, same everything. Okay. The gene expression of the cancer would still be different because your DNA are different. Okay, even with twins, no. So I'll repeat the scenario. So say for example, we have two breast cancer patients, both stage 4. These breast cancer patients are of, say for example, ER, PR, HER2 positive, so triple positive. Okay, so the treatment, no, in terms of the oncologic treatment, okay, would be the same in terms of the conventional side, the guidelines. However, the response of these two patients would be very different. Why? Because the genes are different. The genes are different, okay? So, even if we do get twins, so say for example, both breast cancer patients are twins, same, say for example, identical twins, the response of the treatment would still be very different because the cancer evolves and mutates along the way.
Okay.
Okay? So, there would be products which will work well for one cancer patient, and same product will not work, will work differently on another cancer patient with the same diagnosis. So this is why cancer treatment should be personalized and not it should not, as much as possible, no, it should not be a shotgun approach or a blanket approach, or for example, okay, for all prostate cancer patients or breast cancer patients, this is my protocol, this is what I give you. Yeah, it should not be that way. Okay, so yeah, so that's my that's how it is. That's how it is. Yeah.
Okay, so for those of you who wish to have a consult with Doc Jansen Calalan or any of our many PPAR partner doctors, you can schedule an appointment using the link in the description box and comment section below. Sir Shan?
I just want to take the opportunity, since Dr. Jansen brought it up, that to just make it clear for everyone. Not every cancer, not every cancer is the same. So just breast cancer alone has many different types of breast cancer. And one breast cancer patient can have more than one type of breast cancer. So example is a friend of mine who I referred to Dr. Jansen. She actually had 4 different types of breast cancer, of cancer cells in her breast cancer, in her breast tumor. So that there is a perfect example, because as patients who prior to having cancer, all we thought was, oh, cancer. If it's liver cancer, it's one type of liver cancer, or there are just a few different types of cancer. Well, there actually is quite a lot of different types of cancer, and even for a single category. Yes, there are established protocols for each different types of cancer cell. So this is why if you're going to go for conventional therapy, you want to use the correct drug, right? You want to use the correct drug. There are drugs actually tailored for you for your specific cancer. So, Doc, I think this was segueing into one of the questions that was asked. Someone asked, 𝘂𝑟𝑎tes 5 automatically means malignant cell, right? And do I have to proceed with biopsy right after? I think this is
yeah.
A
Question thrown privately, let me repeat it. From Miss Lisa, does 𝘂𝑟𝑎tes 5 automatically mean malignant agad? Do I really have to proceed with biopsy right after?
Yeah.
There is a 5% chance that it is not malignant.
Yeah, but it's a 95% chance that it is, right? Yeah, Doc.
Yeah, so question is, do I really have to proceed with biopsy right after? If you are my family member, the answer is yes. Yes, the answer is yes. No. Why? Because time is against you. I mean, this is most likely what you have is cancer, and if you do have cancer, then over time, the longer that you wait for treatment, then the higher the probability of it, mutating and producing a different or resistant cell line, or it progressing to a higher staging. Okay, so biopsy would have to be done immediately for you to get treatment as soon as you can, because no doctor would treat you without knowing what kind of what the diagnosis is. Okay, the treatment is based on the diagnosis, so the biopsy is needed.
Which is what exactly why this question is a good connection to my previous statement. Not every cancer, your breast cancer has different possibilities what type of breast cancer you have. Even if you have colon cancer, there are possibilities, variations of the cancer. So you need the biopsy to identify exactly what type, so that the right drug will be given to you, because you don't want to take a drug that is not so effective, yet you will suffer through all the possible side effects and fatigue on your body. So this is why biopsy is really important. And this one, for me personally, I just want to add that if you have cancer today, I think the question should not be, should I go natural or conventional? All right. I think this is a question that belongs to the early 2000s or 1990s. All right. Where there's an argument which is better, natural or conventional. It's a trick question. The right answer is in both conventional and natural, they're going to be right protocols for you. So use both so that you will be very, very effective in fighting your cancer. So it's wrong to say which is better, conventional or natural. No, natural has its uses, has its strengths and advantages, and also its disadvantages, same as conventional. What you should be thinking now is which conventional and which natural protocol should I use to give me the best fighting chance to beat cancer. So it's no longer the question about should it be natural or conventional. It should be which is the best combination of both that will allow me to beat cancer. All right. Yeah.
Okay, before we go to the next question, let me just greet our avid viewers, Miss Edna Alarcon and Miss Noemi Veras from Bicol, and of course, Miss Janet Q from Child House. Okay, next question from Miss Susan Nalugon. Doc Jansen, I have breast cancer stage 4. Finished my 18th session of targeted chemo, metastasis in my bones. I have my chest PA X-ray, found out fibrotic in my upper left lungs, seen. In my liver ultrasound, no more tumor, can be found normal, no fatty liver. What will be the best PPARS product should I take?
I have to know more about your condition. The things that you just told me are not enough for me to recommend a specific protocol. So you have to consult. Yeah. Unfortunately, you have to consult. No, you have to consult. But it's good news, no, that you've graduated already from the 18 cycles of trastuzumab. That would be trastuzumab. So it's not chemo. Okay, that's targeted therapy. Yeah, and it's good, no, that there are no metastases to the lungs, to the liver. Just have to take care of your bones.
Wow, that's good news. Good news.
Okay, next question from Mr. Villa. Hello, may I inquire which products would you recommend for varicocele and mild fatty liver?
Okay, varicocele. For men, very important to know. Varicocele is it's like varicose veins, but it formed in a blood vessel. No. Blood vessel. No, not blood vessel. So you have your testes. From your testes, the sperm will drain towards the vas deferens, go up and down to the penile shaft. So the varicocele, it's like a varicose vein that is formed on the connection between your testes and just above your testes. Okay, so that's the varicocele. So for varicocele, it's not good because that will pull the blood inside your testes. So that can increase your risk of becoming infertile because of the increase in the temperature of the testes. Okay, varicoceles can also be painful if it is large enough. Now, the treatment for varicocele is surgery. If it reaches a certain size, I forgot the size. I think it's 4 millimeters. Yeah, I forgot the size. No, I forgot the size. But the definitive treatment for that is surgery. If not surgery, what if the size hasn't reached the of size? No, what do you do? Just observe. Just observe. Okay. Sometimes it goes away. Make sure you are not straining too hard because straining too hard can also worsen the varicocele. So you have to have good bowel movement, and that is where PPARS can come in. No, offer good bowel movement, but not a direct treatment to the varicocele. Okay. Um, for the fatty liver, what's your question about fatty liver again?
Mild fatty liver lang.
Yeah, which PPARS protocol, I think.
Mild fatty liver.
Hmm.
Which PPARS protocol? Tablets. Start with the tablets. Yeah, so because the tablets can immediately give you better bowel movement as well. So to lessen the straining.
I want to add that for everyone, right? You know, I always share this rather surprising, I guess, quote or advice. Our best product is actually the tablets, in general. All right, why? Because it's a product that can be taken. It's basically food. It has so many wonderful benefits, from managing your metabolic syndromes to supporting your nutritional needs when you're going through fighting different illnesses. Our extracts are for critical illnesses like cancer, very specific. But why I say the tablets is one of our best product is because it's something that you can take every day, and it supports your health in so many ways and able to help you manage a lot of the chronic illnesses that are in our society today, from hypertension to blood sugar to blood cholesterol to inflammation to neural inflammation, right? All that, to joint pains, to things like to gout, so many things. And it's actually just great for you. And the last benefit is it's really anti-aging, right? It's a longevity. It's a solution because it protects your mitochondrial functions. So yeah, when Dr. Jansen recommends tablets, do look out for more benefits than what you are taking it for. You'll be surprised. You'll see your blood sugar improve. You'll see your blood cholesterol improve. You'll see your skin actually improve as you take it. So it's one of the products that I still take it after 20 over years. I've been taking it for 20 over years. Yeah. Recently I met a church elder, and this church elder is actually a owner of another supplement brand. And the elder actually told me, wow, I think I should take your product because you don't look your age. I say, yeah, we're good friends, right? So it's just to show you, it's really one of the really solid products that you can take, especially for people who've just recovered from cancer or going through cancer. The tablets is really wonderful. Yeah.
Yes, and we already actually have a testimony in our YouTube channel for fatty liver using tablets only.
Oh wow!
Yan.
Solution, right? No need to get the no need to get a more expensive liquid, right? So yeah, it's great. It's great. I love being Doc. I really love being able to share on our program a solution that is actually the least costly of all the protocols that are available, and yet that is actually already the good solution. That's always very encouraging. Yeah.
Okay, moving on to the next question from Kay Ann. What PPARS should I use for allergic rhinitis?
Let's start with the tablets, but don't expect it to go away, with just that, because it's just inflammation that will help. It's inflammation that will lower. The PPARS is also a prebiotic which will help your gut microbiota. So with PPARS, what you will expect is the allergic rhinitis to be less severe, less frequent as well. So that's the outcome that you should be expecting from this, but not totally eradicate your allergic rhinitis, because in order to eradicate allergic rhinitis, then you have to stay away from the allergens.
Yep.
Okay. A follow-up question from Ms. Lyra. For a recurrence tumor, I was diagnosed 8 years ago of breast cancer, stage 2A, already finished 6 cycles of chemo for 3 years. Is the cancer now more aggressive, or there is such cancer that's unresponsive to chemotherapy anymore, meaning resistant to chemo? And
there's no such thing. For me, there's no such thing. Okay. So you started with a cancer 8 years ago, and you finished the treatment, went into remission. I will assume that you went into remission, then it came back. Now, is the cancer now more aggressive? We don't know. We don't know. It can be more aggressive. It can also be less aggressive. How do we know? We have to characterize the cancer. So we have to know the gene expression. To do that, we need a liquid biopsy. So the lab that does that is RGCC. That's one of the lab that I know that can do that, no? That can help us know that. Now, the next question is there such a thing that cancer that is unresponsive to chemotherapy? No, there's no such thing. There is such a thing that a cancer is resistant to a specific treatment, yes. But
yes.
in chemotherapy in general, no. So ultimately, we have to know what the next options are gonna be. So at this stage, what your conventional onco will usually do is to choose the next drug is in line in their guidelines. Now, there is a probability that that medication will still not work. Okay, there's a probability. Now, how do we know for sure that the next treatment that you receive, it will work against the cancer? So at this point, then we really do need to get a liquid biopsy or to do a liquid biopsy. So the liquid biopsy, the sample there is just your blood. So what the laboratory will do with your blood is that they will isolate the circulating tumor cells. So once they isolate that, then they will grow it and then test every single chemotherapy or whatever drug, anti-cancer drug you have or natural extract that they have, and test it against the cancer and see which one will respond. Then the oncologist, so me and the conventional onco, will now have to choose which among these drugs would make sense to use for your case. Yeah. So that's how it's going to be. No, I think that would be the next step in your treatment journey. Now, are there factors that can make no, I'll replace no. Are there things that you can do to help lower the resistance to treatment of the cancer? Yes, there are a lot of things that you can do.
There are agents that sensitize it to chemotherapy. Yeah.
Yes, so there are a lot, no. So you have your repurposed drugs. So some medications that we use would be your proton pump inhibitor, so omeprazole, lansoprazole. You have your flavonoids, your curcumin, your quercetin, resveratrol. By the way, I think PPARS Plus has resveratrol. Yeah, from the grape skin polyphenol. So resveratrol is a grape skin polyphenol. So those are what I mean by flavonoids. What else? No, you have your curcumin as well. Okay, are there procedures that you can do to help sensitize the cancer cells? Yes, there are. No, so you have ozone therapy. You have hyperthermia. Hyperthermia, unfortunately, I don't know if we already have hyperthermia in the Philippines, but in Malaysia and Korea, they have Malaysia, Korea, and I think Japan has hyperthermia therapy already. So hyperthermia is also one way for you to sensitize the cancer to treatment. Now, say for example, you can't afford all these treatments, all these medications. You are so poor that you cannot afford any of this. No. One thing that you can do is during the chemotherapy infusion, you can eat your sweets, eat your ice cream, your chocolate, or whatever sweets that you want.
Wow!
But only during infusion. Only during infusion. So what is the mechanism behind this? Okay. So insulin. So the trick there is insulin. So what we're doing is insulin potentiating therapy. So insulin, the function of insulin is when it increases, it opens the door of the cells so that glucose can come in. Your blood glucose can come inside the cell. So this happens, the same thing happens in cancer cells. Now, cancer cells really love glucose. So when insulin spikes and insulin attaches to the cancer cells will open up their glucose gates, glucose channels, and get all the glucose that they want. Together with that, chemotherapy can come in. So this is sort of like a Trojan horse-ish mechanism. So when you eat your sweets right during treatment, since what you ate is very high in sugar, that would get absorbed quite fast to your bloodstream. And at the same time, your body will produce very high amounts of insulin. So when your insulin spikes and during that chemotherapy, the chemotherapy would be able to go inside the cancer cells easier. So that would eradicate the cancer cells faster. So that's also one way for you to reduce chemo resistance. Yeah, and I think mindset as well. You look forward to your next chemotherapy session. So yeah, so those are some of the ways on how you can reduce chemo resistance. Yeah.
Okay, Dr. Jansen gave quite a long answer, so I'll summarize in case some of you forgot what he said in the beginning. All right, so number one, I think Layara asked a very interesting question. Her question phrased another way is, can my cancer, which is a recurring cancer, has it adapted such that chemotherapy is no longer effective? The answer is yes. Is very no. Yes and no. Yes first is yes. The cancer cell could have adapted to make the chemotherapy that put you in remission less effective. All right, but the next thing is, it doesn't mean that all chemotherapy drugs are no longer effective. There are other chemotherapy drugs in the list, right? So the old one that you used 6 years ago is no longer so effective, but there are other new chemotherapy drugs that will be able to still be effective for your cancer treatment. So doesn't mean that a cancer that has recurred, chemotherapy is out the door. No, because there are more than one type of chemotherapy drugs that combinations that are possible. So yes, chemotherapy is still a viable protocol for you. Next is Dr. Jansen just highlighted something which is very interesting. There are ways you can sensitize your cells to chemotherapy treatment, which means, okay, Doc, just to be clear, some of these approaches that you mentioned may not be used by traditional conventional oncologists. Am I correct? So this is where
yes.
Because I also went for Dr. Homer's class, so it was very, very interesting how some repurposed drugs and some supplements actually sensitize the body to chemotherapy. So this is where integrative medicine really shines. This is not hocus pocus medicine. I mean, Dr. Homer is someone. If you attend his class, you need to be a doctor, all right? Because number one, he's going to talk about mechanisms that only Jhen, me, and Dr. Jansen will understand. He talks about things that he talks about pathways. He talks about biochemistry. So there is actually things that you can do to make chemotherapy even more effective for your cancer treatment, right? So there are certain supplements, certain repurposed drugs that sensitizes. And the trick that Dr. Jansen shared about eating ice cream, I want to say right now, this is an educational program. Do not do this unless you go for a consult with Dr. Jansen, all right? Don't say, I'm going for my infusion tomorrow. I'm going to bring my Kit Kat and Snickers and then munch over there. Please, please, please. We share this with you just to share with you and to open your mind to let you know, wow, there is so much more you can learn and understand about the treatment of cancer and how you can make your current treatment of cancer, your current strategy even better. But in order to do that, everyone please go for a consult with an integrative doctor or oncologist so that you can come up with an actual protocol for yourself. And if you don't know any integrative doctor, or if you live in a country like mine, in Singapore, there aren't any integrative doctors, but you want to find out more, you can always go for a teleconsult with Dr. Jansen. So for those of you who actually, like, for example, calling from countries like Singapore, when you go for a consult with an integrative doctor like Dr. Jansen, first of all, sorry, I'm just going to take the opportunity because I was told there were going to be some Singaporean viewers today. So just to share with them what in the world is an integrative doctor, all right? So an integrative doctor like Dr. Jansen is actually a full MD, medical doctor. Like Dr. Jansen is a medical doctor. All the doctors that I work with are the integrative doctors I work with are all full medical doctors. Some are ER specialists, some are endocrinologists, some are family medicine. Okay, so what happened? Their stories are almost identical. I would say 80% of these doctors have the same story. Which is, but not the case for Dr. Jansen. You're actually the odd one out. For the other doctors, it was always because some family member got sick. And despite them being a doctor and knowing doctor friends, none of the conventional protocols worked for their loved ones. So, of course, they didn't give up. They took their medical knowledge, what they learned in med school, their biochemistry knowledge, their anatomy, pathology knowledge, and they went outside beyond conventional medicine and looked for other protocols that would work. And they found that it worked. And for many of these doctors, the moment they found that it worked, their mind wow, this is a whole new interesting area of study that was not covered in med school. So they then went to look into it. And then comes this term integrative doctor, right? Integrating conventional medicine and newer protocols like nutrition, lifestyle medicine, and some other innovative ones. In Singapore, we actually have integrative doctors. Okay, but we don't call them integrative doctors. We call them, when you mix TCM, which is traditional Chinese medicine, together with conventional medicine, right? If you ever combine these two, well, that's what you're doing. You're doing integrative medicine, using two different schools of medicine to complement and get the best from both sides so that you can integrate, right, this approach, right? So a very good example is, for example, using acupuncture for pain relief while you're going for, let's say, some physical rehabilitation. That is integrative medicine, because acupuncture is not conventional medicine, it's traditional Chinese medicine. When you use two different schools together, that's integrative medicine. So yeah, for those of you who are looking in a country where it is not available and you want to consult, good news, you don't have to fly to where Dr. Jansen is, although you can. All right, you can always arrange for a consult and he can share with you different options available to you and answer your questions. Yeah. Jen?
There's a question from YouTube from Mr. Hector Clemens. How PPARS helps if you have nodules and goiter?
Oh, yeah, Doc.
Okay, this is something that also baffles me, Now I have treated multinodular goiters with PPARS before, and just with PPARS, and it really works. It reduces the nodules. But the mechanism behind it, I am really not sure. But we can just speculate, at this point. So for nodules and goiter, we have to know first what are the causes. So sometimes it's iodine deficiency. It can be autoimmune as well. Or there's just something wrong with the thyroid that it produces nodules, multiple nodules. So now, PPARS, the product, can address iodine deficiency because it has iodine. It can address autoimmune issues because it can help tone down the inflammation in autoimmune disease patients. And generally just lower down inflammation. So yeah, that's how I think. So we can just speculate about this one because there's no, if you try to chat GPT or Google, there's no study or clinical study with PPARS and multiple thyroid nodules. So this is just purely observational and with experience. Yeah. So will there be patients who would not respond to this? Yes, there will be. So it's not 100%. Yeah, but there are patients who do respond.
Yeah.
Yeah.
So I'll take on from what Dr. Jansen said. On our program, we will say things like this because we're trying to be as medically and scientifically accurate as we can, right? So first of all, we will, as Dr. Jansen said, for goiters and nodules, yes, we know it works because we have patients and it worked. But we will honestly tell you the reason why we can't say we know exactly why it works is because we're basing it on this approach that if it's not tested, if it's not researched and tested, then we can't confirm that's the mechanism. But we can only make educated guess, right? This approach might work for TCM, which is not, with TCM is not tested the same way as conventional medicine tests something, right? So maybe those from a Chinese culture can accept this even more readily. But yeah, the reason why is because we don't actually go out and do specific tests for using PPARS for such conditions. But what we do is really interesting. Doc, I'm not sure if I listed some of the interesting experiments that research that has been done. For example, we did like in 2016, 17, something along there, we actually did some pilot studies on PPAR and allergies, right? PPAR and allergies. So we were looking at the mechanism of action. How does it work? And then the specific results came out is that PPARs actually prevents alveolar infiltration, which means the infiltration of your lung cells from viruses and allergens. That actually helps explain why COVID patients during the COVID pandemic, if you take PPARS tablets, lots of it, you will probably be in a better position than people who doesn't. So, but did we test it with COVID virus? Obviously, the answer is no, right? But because we did other mechanisms, and then we can make an educated guess. So that's why Dr. Jansen and I will just tell you, yes, it has worked. Can we say for sure it will work for you? No, we can't, because we didn't do a conclusive test on this area, but we make some guesses on the possible mechanisms of action, which is why we think it worked on the patients that we did that did use it. Now, your next question is, will we ever do a test? The answer is no, we won't, right? Because there are applications for PPARS that are more, how shall we say, more urgent and more a better focus for resources. We have limited resources, so we will put the emphasis on things that deal with cancer. And also, for Dr. Jansen's information, also we've been discussing the next research. What can we do on areas that are linked to CKD, right? What kind of study of mechanism of action, not CKD itself, but actually mechanisms of actions that would theoretically be helpful for CKD. If we can confirm that, then we can use that to infer and understand why our product helps with CKD. Again, because our product is a natural product, we don't position it as a cure, like a drug. We position it as a nutritional and adjunct and palliative support. So that's why there's, again, no need for us to go into that kind of research. As long as we know the general mechanism of action and we know that it will help, that's enough for us. Because you should still see your doctor and have your doctor support you through medical protocols as well, be it TCM or conventional. Jhen?
Okay. Well, we're almost at the end of tonight's session. This will be our last question for the evening. From Miss Annie. I love eating meat, but lately I feel bloated. What is the best product for bloatedness? My tummy feels a little hard and bloated this past few days.
Stop eating meat. Okay, kidding aside.
Okay.
Kidding aside. You might want to look for, because that's indigestion, no? That can be indigestion. So if you feel bloated, indigestion, hyperacidity, your bowel is not moving as much. So a few things that you may want to consider is to walk more, number one, to help move your bowel. Number two, medication-wise, that would be taking domperidone. Domperidone can help move your bowel. Number three would be take antacids. Another one would be properly. So there are a lot of digestive enzymes available at Healthy Options, so you can go there and shop a little bit. What else? yeah, probiotics, you can also take some probiotics, but probiotics, I don't think it's gonna offer immediate relief. Yeah. Your best bet would be to remove the bloatedness. It would be to take digestive enzymes. You can consider domperidone. Yeah, and if you still have persistent issues, then you can come see me. So we can do a proper consultation. Yeah, so we might request for some ultrasound. You might have gallstones. So yeah, but at this point, it's just speculative. I'm not trying to scare you, but yeah, those are what I think. So it's best to still go for consult.
Yeah, I just wanted to add that, one simple solution, because unlike you, there are certain things I like to eat. And when I take them and my body actually tells me something is going wrong, the first thing is the first thing is to stop eating it lang, okay, just for a while, right? Because if I take antacids to fight acid reflux, and then still drink Coke, for example, right, then it just defeats the purpose, right? Because the simple logic is you want your body to recover, all right? Like, for example, eating too much meat has put your body out of balance. Just to make it simple, using simple concepts, your body's out of balance, right? So you cannot keep putting that thing that is making it go out of balance. So you should, number one, abstain from it. I would actually eat very simply, right? That means clean vegetables, lugao porridge, or just a little bit of rice, lots of soupy stuff, warm soupy stuff, green vegetables, just for a few days. You'll find yourself actually start clearing out. All right. And of course, with all the advice that Dr. Jansen get, that's just going to make it go so much faster. And after you have rebalanced yourself, then not to go back to the sin, but then you can start moderately taking back a little bit of what you like to eat. And this time around, I think you will naturally control yourself better because you just recovered from taking too much meat. And then the next time you see meat, it'll probably not be so enticing. Yes, you'll still like it, but you won't eat so much because you know what pain it'll cause you, right? So yeah. So as Dr. Jansen how shall we say, jokingly suggested, but I think he's quite serious. Stop eating so much meat. All right, at least for the short while. Jhen?
Okay, it looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Dr. Jansen?
Yeah, go ahead. Guys, thank you so much for attending tonight's webinar. So I'm a little bit under the weather. So I have to rest now. So but next week is gonna be new week, and I hope I see you guys again there. Keep on asking your questions. Yeah, we're learning a lot, no? All of us, you and I both, no? And yeah, it's flu season. So guys, please take care, especially cancer patients. Please do take care of yourselves. Make sure you wash your hands, eat nutritious foods. Yeah, that's it. I'll give the floor to Jhen. Thank you, guys. Good night.
Doc, have a good rest. I actually just recovered from a near flu encounter. That means I felt the flu coming. I slept a lot for 1.5 days, and it didn't set in. So once again, thank you guys for joining us. You're the reason why we do this, and I hope that this tonight has been fruitful for you, that we have managed to answer all the questions. Okay, wait, I just saw one last one. So before I go, let me answer that. Good evening. Can we take PPARS and do radiotherapy? The answer is yes. In fact, it's good, right? Radiation therapy or radiotherapy is actually immediate. So what you can do is you don't take PPARS at the same time. That means you don't take PPAR when you're doing the radiation therapy. Give yourself like a 12-hour before and after. So let the radiation do its work, let it do its damage to the cancer cell, and then after that, take PPARS to recover. Right, so PPARS actually will help your body displace or absorb radiation. All right, so for example, I'm going to share a very interesting thing. If you ever watched the original Marvel's movies, Iron Man 2, he kept drinking from a water bottle with a green liquid inside because Tony Stark was suffering from radiation poisoning because of the radiation he put in his chest. So the writers in Hollywood actually did their research. Green algae can actually scrub or absorb radiation, right? So when you go for radiotherapy, you also want to clean yourself up after that. So taking PPARS, even if it's just the tablets, is going to be helpful for you, right? So yes, you can take it together. You can take it together, but give a maybe 12-hour time space where you don't take it when you're doing your radiation treatment. All right? Okay, so again, thank you very much for everything. We look forward to having you. And if you enjoy asking all these questions, guess what? We're going to have our second live SMX event, which is those of you who live, for those of you who can get to Metro Manila, go to the best and one of the nicest part of the entire Philippines, which is Bonifacio Global City, right? If you are Filipino and you've never been to BGC, come on, right? It's basically as nice as Singapore's Marina Bay Sands financial area, all right? So it's like as nice as the best part of Singapore. So go to BGC on SMX on November 15 on a Saturday morning. Me, Dr. Jansen, and we're going to check which other doctors can join us. We'll be there live to answer your questions, right? So it's not going to be like tonight where you can type only. You can actually ask us live and we're going to be able to answer your questions in person. So it was going to be a conversation, and it's always exciting. People always don't want to go home. They want to ask more questions, but we will end it. It's not going to go on and on, right? But it's something that will be very helpful. And for those of you who really want to see Dr. Jansen in person, this is a great opportunity for you to do so. Okay. So with that, I'll turn the time back to Jhen. Thank you, Jhen.
Thank you so much to our experts, Dr. Jansen Calalan and Mr. Shyan Lim, for sharing their expertise, knowledge, and insights. If you have any follow-up questions, don't worry, we will answer them next webinar or via direct message. And we hope to see you again next week for another back-to-back empowering sessions, same day, same time, every Thursday night at 7:30 p.m. October 16, we'll talk about managing chemo side effects by understanding PPAR pathways and how they can help with the cancer journey. But before that, let's first discuss about recurrence-proofing the body with natural strategies to stay cancer-free on Simply Nature Answers, or SNA, this Tuesday night, October 14, 7:30 p.m. O, diba? Now, on a scale of 1 to 10, how excited are you sa Lazada 10/10 Magic Sulit Sale? Get your favorite Cleansing Plus and PPARS tablets starting tonight until October 12, Sunday. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from start to healing.